Hey, my name's Jaron Thewison, in case you don't know who I am, and I'm helping Dr. Pinzone with a really cool project called Second Chance Smiles. In case you haven't heard of this project, my job right now is to explain a little bit about it. But before I go and explain about the project Second Chance Smiles, I want to talk to you about the homeless population that this project helps. Last year, when I was in Dr. Pinzone's class, one of my favorite rotations was going to the 4th Street Clinic. I like talking with Dr. Keel and meeting these people because they are so misunderstood. A lot of them just need help finding a job. A lot of times we associate the homeless with drug problems and abuse and violence, and these are just a lot of good people that have just ran into some really hard times. And I thought, how as a dental student can I really help these people maybe get a second chance at life? And a lot of the time, these people have really bad dentition because the homeless population doesn't have really good access to care. They have a few clinics that they can go to that are free, but the resources at those clinics are limited because that's just the way it is. They have to help as many people as they can. And so, for example, a homeless person might come to the 4th Street Clinic, which is an awesome clinic that's done over $1 million worth of dental work since it opened, and this person might come into the dental clinic and have a toothache that normally we might be able to do some endo on to save, but because that's not in the budget, that's not what the 4th Street Clinic does. Oftentimes, this tooth gets extracted, and a lot of times, homeless people have a lot of teeth that are extracted, especially in the anterior region of their mouth. And this can be a problem if you're trying to find a job and you're trying to talk to someone in an interview. It can be distracting, and a lot of times judgments pass based on a person's smile. So I thought, well, if we could just go and make flippers for these patients, we might really be able to go and help them find jobs easier. A dental flipper is like a denture that a person will wear, and it can go and just really increase the aesthetic outlook of a mouth. So that's what our project does. Is we have an 8-week program. The first week we do some education with the patient, and then in the subsequent weeks we make the dental flipper. And making a dental flipper is actually important here at dental school. Uh, in your second year of dental school with Dr. Durham in the edentialism class, you're going to learn how to make a flipper really well. So this project's actually kind of cool because it could kind of be a head start in that class. Teach all about the retention and stability that is involved in dental flippers. So, in part of this 8-week program, right, where we're going to do the education and make the dental flipper, afterward, we're going to have an evaluation after the flipper is completed and it's been delivered. And then we're going to follow these patients periodically every couple months to see if they found a job, if it's helping. And our goal is to see if these dental flippers really do help these homeless patients find jobs faster because they have more confidence, they feel better about themselves, and their employers can feel more confident in their appearance. So if this is a project that interests you, reach out to me. I'd be glad to talk to you more about it. Talk to Dr. Pinzone. This project is cool because the sky is the limit. If this is something that really helps the homeless, we'd like to expand it, and we're really looking for people to help lead and who have expertise, people that are caring, that really want to help this population and the state of Utah. So if this is something that might interest you, I encourage you to come talk to me, and we can talk about this project, Second Chance Smiles. Thanks.